Good morning, students. Today I will show the surface markings of thorax, and I will show you the markings one by one. First of all, I will mark the tip of 9 costal cartilage. To identify the 9 costal cartilage, I will locate the sternal angle, and at this level you will get the second rib or second costal cartilage. Then below that the second intercostal space, then third costal cartilage, fourth costal cartilage, fifth costal cartilage, sixth, then seventh, eighth, and ninth. So this is the tip of 9 costal cartilage, and I will mark on that point where the lateral border of rectus abdominis muscle cuts this tip of the 9 costal cartilage. This is rectus abdominis, and this muscle may be make prominent, asking the individual to contract the muscle. This is rectus abdominis. So lateral margin of rectus abdominis cuts the tip of the 9 costal cartilage here. What is the importance of this tip of 9 costal cartilage? And the tip of 9 costal cartilage, if I take the point on both sides and if I join, this line will be transpyrotic plane. The transpyrotic plane is important plane because so many important structures lie on this plane, like fundus of the gallbladder, then the formation of portal vein, then origin of superior mesenteric artery, origin of renal artery, hilum of the kidney, the lower end of the spinal cord, and the vertebral level lower border of L1 vertebra. So to draw the transpyrotic plane, first of all we have to mark the tip of the 9 costal cartilage. Next point is sternal angle. This angle is very important. To mark many points on the anterior abdominal wall, first of all we have to locate the sternal angle. And besides that, when we draw the surface markings on the thorax, in that time also we have to locate the sternal angle. How to locate? I told it repeatedly. This is the sternum in the midline, and this is suprasternal notch. This is manubrium sternum. So I will feel the sternal notch or suprasternal notch, then I am proceeding my finger towards the sternal angle, which is an elevated area in the midline. So this is the sternal angle. Here I will draw a line. This line indicates the junction of manubrium and body of the sternum. If I draw a line from sternal angle posteriorly, this line will cut the lower border of T4 vertebra, and above it is the superior mediastinum and below it is the inferior mediastinum. So this sternal angle is an useful demarcation between the superior mediastinum and inferior mediastinum, and it cuts the lower border of 4th thoracic vertebra. And other importance of the sternal angle are, we can identify the second rib, so we can count the ribs, second, then third, fourth, fifth, sixth, like this. And at the same time we can count the intercostal space also. This is the second rib, so below it is the second intercostal space, then third rib and with third costal cartilage, below it is the third intercostal space. In this way we can count the ribs as well as the intercostal spaces, and it is the junction of the superior and inferior mediastinum, I told you, and trachea also bifurcates at this level of sternal angle. Arch of the aorta begins and the arch of the aorta ends also at this level, and the thoracic duct, it deviates from right to left at the level of the sternal angle. Here it is the junction between the extra and interpericardial part of superior vena cava, where the arterioazygous vein drains into the superior vena cava, and this level also is a junction of two discontinuous dermatomes between the C4 segment above and T2 segment below. That means C4 here and T2 below. So this is the two different dermatomes, and two are discontinuous dermatomes at the level of sternal angle. And during inspiration, or in other words during respiration, the sternum moves forward and backward at the level of sternal angle, because this angle, it is the joint between the manubrium and body called sternomanubrial joint, which is a symphyseal joint. So some sort of movement is there, and due to this movement the sternum moves forwards and backward during respiration. So all these are important landmarks at the level of sternal angle. Next point is apex of the heart. Here also we will count the ribs because the apex of the heart, it is at the level of fifth intercostal space on the left side. So to count the intercostal space, this is sternal angle and here is the second rib, then second space, then third rib, third space, fourth rib, fourth space, fifth rib and fifth space. So this is the level of the fifth intercostal space. And we will go toward the left side. So left fifth intercostal space about 9 centimeter from the midline. So the level is here, this is about 9 centimeter from the midline. So this is the point of apex of the heart. The question is, which part of the heart forms the apex? It is the left ventricle of the heart which forms the apex, and the musculature of the left ventricle is 3 times thicker than the right ventricle. And you know the thickness of the left ventricular musculature is about 8 to 12 millimeter. Musculature at the apex, it is thin than the other parts of the ventricle, and the shape of the apex, it is conical and directed downwards, forward and to the left. The apex of the heart is the most mobile part of the ventricle. And what is apex beat? Apex beat, it is the downward and outmost thrust by the heart in the left fifth intercostal space during ventricular systole. And one important question is there, the apex beat and the apex of the heart, both are same, their position? No, the apex beat, it is about 1.25 centimeter medial to the apex. Here you will get the apex beat and it is the apex. So it is about 1.25 centimeter gap. So that part is important from the clinical point of view. Another important surface marking on thorax is bifurcation of trachea. To draw this, once again I have to locate the sternal angle, and I will draw 2 parallel vertical lines here above the sternal angle, and these 2 lines are about 2 centimeter apart. And here at the level of sternal angle, we will draw the bifurcation. This is the bifurcation of the trachea. From this drawing, you can identify the 2 bronchus, right bronchus and left bronchus. Right bronchus is shorter, it is about 2.5 centimeter, and left bronchus about 5 centimeter. It is wider and it is narrower. And if I draw the angle between this right bronchus and the midline, it is about 25 degree, and on the left side it is about 45 degree. So total angle 25 plus 45 is equal to 70 degree between the right and left primary bronchus. So trachea, it is having so many tracheal rings. There are 16 to 20 cartilaginous tracheal rings are there, and the cartilage is hyaline cartilage, and the first tracheal ring is the broadest one, and the last ring where it bifurcates, here you will get a projectional process called carina. This carina, it is an useful guide during bronchoscopic examination. What is the vertebral level of the tracheal bifurcation? This one. And you know the sternal angle, it is at the level of lower border of T4 vertebra. This level you will find in the cadaver in supine position, but in living and standing position the level is lower border of T6 vertebra, and in the newborn it is about at the level of T3 vertebra. And you know the tracheal bifurcation occurs at the level of sternal angle. So trachea lies in the superior mediastinum, and at its bifurcation the trachea is deviated slightly towards the right side due to the arch of the aorta. And if you, what are the important structures related to the site of tracheal bifurcation, number 1 is the deep cardiac plexus lying in front of the bifurcation, and 3 groups of tracheobronchial lymph nodes, 1 group below and other 2 groups at the side, here and sides. They are called tracheobronchial lymph nodes.